It was definitely a very eye-opening, something completely not on your radar at all. You know, when you're 36 and feel like you're relatively healthy, discovering that you have cancer is not something you thought would happen. There was an obvious lump, and I probably spent a little too long kind of justifying why it was something other than cancer or something to be concerned about. But I got it checked and biopsied, and we discovered it was cancer. And so we immediately went into, you know, what's the right plan, what's the right course of action.
Betsy has been such a pleasure to work with. She got diagnosed at the start of the COVID pandemic in spring of 2020, which was a difficult time for all of us, and she had a new diagnosis of breast cancer. She came into clinic at that first appointment with an upbeat attitude, and I could tell that she was very motivated to start treatment expeditiously and had a firm determination to continue her cancer-directed treatment.
We started with 6 treatments of chemotherapy, and then we went into surgery, and then we went into radiation. And all throughout that time, because I was HER2 positive, I was continuing to get infusions. If there was something that could be done, we did it.
Breast cancer, as we know, is the most common cancer of women in the United States. It is not common to be diagnosed with breast cancer this young. So about 9% of breast cancers are diagnosed in women who are younger than age 45. It is relatively rare to be diagnosed younger than 40.
Logically, you know it's possible, but there's no history of breast cancer in my family. So like even when I told my mom was, no, it's gotta be something else. Like you're young, you're healthy, there's no history of it. So it's not something that you think about, you know, that's something that happens to women who are older than me or women who have a history of it in their families. And no, I mean, it happens, and then you have to deal with it as it comes.
Breast cancer screening is recommended starting at the age of 40 for all women. Some women are recommended to start earlier if they have a family history of breast cancer, or if they are genetic mutation carriers, or if they've had a history of radiation to the chest. Betsy had none of those. So, you know, Betsy is an incredible example of noticing something that doesn't feel right and talking with your doctor.
There's no point in trying to deny that something's wrong. Like if you think something might be wrong, go get checked out, get help.
Stay up to date with breast cancer screening, know your family history, talk with your doctor about your family history. If you notice changes in your breast exam, feel comfortable talking with your doctor about that. Life is busy, but be your own advocate. That's probably the best advice I can give women.
You have to take it as it comes, and you just deal with it one day at a time. All of my scans come back good. My blood works looked good. Dr. Copeland and I were just discussing that I've just hit the 2-year mark, and after the 3-year mark, the odds of recurrence go down significantly. So, you know, things are really good at this point, and we're hoping that they stay that way.